Hello, and welcome back to Blueprint to Wellness and Success with Dr. Ada and
And
PA
PA
Smith.
Smith. Hey guys,
Yes,
hey.
hello, guys. So excited. We have an amazing guest today, another amazing guest. Who do we
Mhm.
have today? Um, Jeanette, yes. How do you
So it
know?
is my PA colleague, PA Julie Blackpert, and we welcome her. Thank you for coming
Welcome.
on. And
Thank you.
she's going to actually give her bio, which is fabulous and fantastic. And so, Julie, can you tell them about yourself?
Yeah, I'm happy to share a little bit. Thank you for having me, Dr. Ada and Jeanette. We go way, way back.
Thank you.
So
You're welcome.
both Jeanette and I went to the SUNY Downstate PA program, and we've both been physician associates or physician assistants for 25 years now. And I have worked in different areas. I started out in family practice medicine, and then I had a stint in asthma, allergy, and immunology. And then I went and I became an assistant professor and the senior clinical coordinator at the SUNY Downstate PA program. After leaving there, I worked in women's health, gynecologic oncology at University Hospital in Newark, where I live now. Used to live in Brooklyn, but now I make my home here in New Jersey. And I really just had kind of a switch off to doing something extra on the side while I was working at the school at University Hospital in Newark because I wanted something else to do. And I needed to do something on those extra days when I had some time off. And so what I started doing was ear piercing, just the earlobes, because I never really was particularly happy about what I was seeing when I'd go to the mall.
Okay.
And I felt that there was a definite need for a better way to give these piercing services to um, people. I started 4 months. I go to adults. I think my oldest client was probably 88 years old. So I knew men, women. It's
Wow.
fantastic. That's what I like doing.
Wow. Amazing.
That
Amazing.
is
Thank
pretty
you.
cool,
Thank you
pretty
You're
for
cool.
that
welcome.
bio.
And Julie, also
Mhm.
what's fantastic about you is that you also have other talents besides if you can brush on those just a little bit, and we
Oh my
plan
God.
to have you coming back because Ada she has been in photography, she's been a model, I love to dance, so we both love music. Can you
Mhm.
tell us that other piece of your life?
Oh my goodness, we have more in common than I ever imagined. Well, my first degree was from St. John's University. I
Oh,
got my degree in broadcast communications. I
Oh,
spent a
wow.
stint as an doing what do they call it, kind of cold calling and canvassing, going to around to different businesses, getting them to buy radio airtime. Let me tell you, that was
oh.
tough.
Oh,
But through that, I got involved in the entertainment industry. I've been an entertainment booking agent for a major booking agency for years and have booked many artists over the years, hip hop, rap, R&B, that sort of thing. And I eventually started my own company, Black Star Entertainment Group, where we do production for house. I love house music too, dancing and that sort of thing, house music. And we manage Kenny Bobian, who's a house music artist. But over the years, I've kind of considered myself a very multifaceted person. I like
Mhm.
to do a lot of things. And I, I used to do photography when I took courses at Pratt Institute in Brooklyn years ago.
Cool.
So
Mhm.
we share a lot of things in common, I
That's
see.
so
Yes,
cool. That
yeah,
is
we
so
can
wonderful.
definitely relate. I know Jeanette as
absolutely.
well. Yeah. And what you said prior, I mean, I definitely can understand that. Like looking for something else other than what we do full time
Hmm.
in
Hmm.
Hmm.
our jobs. Yeah, yeah. For me, I don't know if you know, creating a skincare line. In other words, it was something I
Yes.
was passionate about, but yet it wasn't connected directly to my field of work.
That is the key phrase you said, passionate about. Because
Yeah.
most people take ear piercing as something that's kind of, it's mundane. What's the big deal about it? But there really is a big deal about it. And because I didn't like what I was seeing when I was going to the mall, and a lot of times it was just very minimally trained young people doing it.
Hmm.
Up
Yeah.
until the summer of August 2022, there were really no set rules and standards for those little kiosks and mall places that you used
Hmm.
to see.
Mm,
So people were coming out of there with a lot of issues, either unbalanced piercings or they were getting infections. And there just wasn't the proper types of protocols that were being used for infection control and safety that you would expect should be used in those types
Mhm.
of environments. Just wasn't. So I met a doctor who was a pediatrician who trained me in this system. I use the Bloomdahl medical ear piercing system. It's very
Mm.
efficient. And we can talk a little bit more about it later on, but it's very efficient. And I feel that it really gives parents, especially, another option, because who wants to take their baby to the tattoo parlor to get
Right.
the ears pierced?
no, not very
Not many.
appealing.
No,
Not
not so
very,
much.
yeah, yeah.
So, okay, I'm going to start with the question. So,
Sure.
Julie, what piercing methods do you use? Needle versus device, and why?
Okay, well, I just touched on that a little bit. I do use the Bloomdahl medical ear piercing system, and it is called medical ear piercing system because they do not supply their products, their ear piercing instrument, which is, by the way, a registered medical device, or the earrings to anybody that does not have a medical license. So, of course, as a practicing PA, I had to provide that to Bloomdahl. We use 100% titanium, which is what we call implant grade or medical grade. We
Mhm.
don't use gold or any other metals. And the reason for that is because implant grade titanium has an extremely low profile for causing allergy problems. When we use other metals, people can get allergy problems, especially with the costume jewelry and the low carat, like
Mhm.
10, 14 carat. So we try to stay away from that. And they provide an excellent quality earring and service. So, and you're getting a professional doing it. So you know that it's going to be
Right.
safe.
That's
Oh,
good.
I don't like to use
absolutely.
needles because
I
they're okay. I'm so sorry. You're going to say?
No, no, I'm sorry to interrupt you. I was going to
I'm,
say I wasn't even aware that such services were available. I mean,
There are
I
not
think,
that many of us. I prefer not to use needles, especially on babies, because if babies move around a lot, and it's a little bit longer of a process. You have to put the earring in the catheter. You put it in, and you have to take the thing out, and you got to screw it on, and it's a whole big thing. And I just
Mhm.
don't want to risk somebody getting poked back here.
Right.
My earrings come with the post. The sharp end gets covered immediately, so nobody's getting jabbed or stuck, and it
mhm,
Mm.
works really well. It really does.
amazing.
Okay.
Okay, so the next question, and I wonder, I guess you kind of touched upon it a little bit, but how do you ensure cleanliness, sterilization, and overall safety for clients?
Okay. So first of all, my office is in a medical office building. You come to
Right.
an actual office. I have supplies and things there that are required to sterilize my equipment. I don't reuse the marking pens to make the dots. I use sterile surgical grade marking pens that you would use for any operation, and they go in the garbage as soon as I'm finished with them. So no using the same pen over and over again. There are gloves worn throughout the entire process. The law says we must wash our hands with soap and water, not just use hand sanitizer. So I take all these precautions and all the right steps to make sure that things are done in a clean way at my office and that the risk of infection stays very low by abiding by proper protocols for infection control.
Hmm. Okay. Julie, what types of jewelry materials do you offer? You said this before, but if you could
Yeah.
repeat it, do you offer to first-time piercing?
Yeah. Well, particularly for the first time piercing, I did mention I use the implant grade titanium. One of the reasons why we like that is because when you do a piercing, you're creating a wound. Okay. That wound is subject to impurities and all kinds of things. If you're using anything other than implant grade titanium, and there are other metals that can be used like rhodium, or, we just want to make sure that it's the best metal that's going to give you the less profile for possibly having an allergic reaction.
Mhm.
When you use gold, 24 karat gold, pure gold is very soft. It's not a very stable metal. So what they do is they add nickel to it to help stabilize and harden this metal. And when you use gold, most people pierce with like 14 karat or 18 karat, which is okay. But if you don't know you have an allergy sensitivity to nickel, With
Mhm.
14 karat particularly, you're prone to getting that itching, that swelling, that oozing, that sort of
Mhm.
thing that says this is not quite right for me. And there's much less chance of that when we use the titanium. That's why we use it.
Okay.
Mm. And Julie, how do you help clients choose the right piercing and the jewelry for their lifestyles?
Hmm. Well, part of it is very easy for me because I only do earlobes. I made a conscientious choice that I do not do cartilage or any other body part. Uh, People want to pierce other areas, that's fine. I'm just not your girl, you know.
Mm,
A cartilage piercing really does take twice as long to heal and is much more prone to being infected. We
mm,
just don't have as good a blood supply to the cartilage areas, which is things like the tragus
Mm,
and up here, the top of the earlobe. So I only do everything that's down here, the lower lobe, right? And we just want to be sure that it's, the safest possible piercing that it can possibly be.
mm.
good, good, good.
Okay, Jules. So, what age requirements or parental consent policies do you have in place?
Okay, so I started age 4 months and I go to adult, males and females. Now, the reason why I started at 4 months is because it's not mandatory, but I actually prefer that the little ones have their first few rounds of vaccination, especially their tetanus, the diphtheria, and acellular pertussis to help protect them. Their little immune systems are not used to a lot yet, so we want to help protect them. Some people don't do vaccinations. So I'm not here to judge where that's concerned, which is why it's not mandatory, it's preferred.
Hmm.
But
Hmm.
we do like to have them have the vaccinations if at all possible as a protection for the babies.
That's good.
Mm. And Julie, what is your aftercare and how do you support your clients with the healing process?
Okay, so aftercare, there's standards in ear piercing. Some people are not so crazy about the idea of using what they call a gun. All right, the instrument that I use is not really a gun. It's a sterile cassette where the earring is encapsulated in that, and the instrument is merely the handle that helps to drive the actual earring. So we discuss everything from beginning to end. I don't do anything to anybody during a visit without telling them what's happening next. I'm raising your chair. We're going to put alcohol and clean your ears. We're going to do the dots. The aftercare is very simple. 2 times a day for 5 days. We give them a sterile sodium chloride solution, which basically is a wound wash. We want to keep it nice and simple. We don't want any tea tree oil and all these other fancy scents and crazy things, keeping it simple. And for those of you who might not know what sodium chloride is, when you go to the doctor or the hospital, and sometimes they have to give people fluids because maybe they're dehydrated or something like that. They give you an IV solution of sodium chloride. It's the same type of thing. It's pH balance. It's not going to sting or burn. It's going to help the body heal without any harsh chemicals, and that's what we want them to use. So we give it to them as part of their package. Everything's all encompassed in one
Included.
price.
Good.
Okay. So, well, how do
I'll
you
ask one
handle?
more question, doctor, if you don't mind. It's
Yes,
what
yes.
sets your ear piercing business apart from other competitors?
Well, as I was saying before, there's really not a lot of us who do this. I do know there are some nurses here and there that do it. Uh, you want a clinician to do this because you want to make sure that you're working with somebody who understands the standards, the cleanliness. It's not like when you go to the mall, everybody's standing around, they're looking at you. I'm like, why don't you just go shopping already?
Yeah.
This is not
Mhm.
this is not a show. A lot of places in the mall, they would just use hand sanitizer. I see people with gloves on, without gloves on. This is just not right. They'll have gloves on and somebody will say, can I see these earrings? And they'll go and they'll touch earrings, they'll touch money without changing their
Right.
gloves.
Mm,
Infection waiting to happen. Oh my goodness, it used to just really upset me so much. So you
Mhm.
really want to come someplace where it's just you and the clinician. You can bring family and friends along. It's quiet. I explain everything to you. The law says I must give you your aftercare instructions verbally and written, and you'll get both of those when you come to my practice. So that's one of the big differences. You're having a clinician doing it, not somebody who's minimally trained for an hour or two and just really doesn't know what to look for, when to pierce, when not to pierce. If you come to my office and you have cysts, scar tissue, and various other things going on that I feel are contraindicated for getting ear piercing, I'm going to tell you that. I'm not going to
Mhm.
pierce you if you're
Right.
not a good candidate, and you want that level of understanding, the need to do or not do.
Julie, and how do you deal, now that you mentioned infection, how do you deal with complications, with infections, with swellings, with allergic reactions?
Okay. Well, I discuss it and I hand everybody an aftercare sheet that gives instructions on what to look for. So the basics that most people want to look for is when you do the piercing, there is a very minimal amount of swelling that goes on, but most people don't notice it. It is a cut. There's usually no bleeding with the ear piercing process. But I let them know to keep an eye out for something that's like looks like it's really swollen, a lot of redness, heat from the ear piercing, the earlobe, and pain. Those things usually do not happen because these risks for the infections are low. We make sure that they're washing their hands before they touch their ears. We're telling them to make sure that friends and family don't come up and touch the ears, hands off, okay? Try not to sleep on your side if you can because it may be tender. It's a wound, all right? But we do give them instructions to use the same sodium chloride wound wash for up to 2 days at home. And if they don't see that there's getting any better, then they need to go to their provider. And the reason for that is the Department of Health does not recognize the ear piercing office as a regular clinic. So if somebody needed to have an antibiotic ordered, although I can do that because I'm a PA, these are clients, they're not patients. So I need to give them the information to go to their provider or urgent care if they're not seeing their problems start to clear up within 2 days. We never want to take this earlobe for granted. It's attached to your head, and infections go in and they go up, and we
Mhm.
don't want to see anything go wrong. So we want people to jump on that early if they think there's a problem.
Absolutely. And finally, anybody looking to opening up ear piercing business, what kind of advice do you have for them?
Now, well, not to be judgmental, because like I said, a lot of people have different opinions about ear piercing. If you decide that you want to open up a traditional ear piercing business using the needles, by all means, you should. The Association of Professional Piercers, the APP, has set very strict guidelines that are standard for ear piercers who use needles. But if you wanted to do something like what I'm doing, it's a simpler process, but you really do need to be trained in it. It's not something that we take for granted. You have to know when to pierce, where to pierce, how close to pierce, when you shouldn't do it, whether somebody should come back. I see people who have torn earlobes sometimes and they've had them repaired.
Yes,
You have to wait the appropriate amount of time before just jumping into getting your ears re-pierced again. Otherwise, you risk them tearing or not healing well, having scar tissue. And there's just a whole lot of other things to look out for. When you go and if it's just some teen at the mall, they don't know that, you need to ask questions about whether people have histories of keloiding or what types of medications they're taking that might cause them to have bleeding. There's somebody else that might not, whether they're diabetic or, these types of things are really important too, because people with diabetes, especially if it's not controlled, we know they don't heal as well as everybody else. So we have to
Yeah.
take extra precautions. Yeah. So if you're interested, somebody's interested in this, you really have to take time to know the business. It's not something to go into willy-nilly. It's just really not.
Yeah.
right,
And
right.
Julie, how do people reach you and your phone number, your website, your
Okay.
location? Can you share that with us?
Most people find me by just going for an internet search. My company is called Clinical Piercing by PA Pro Medical. PA Pro Medical is the parent company. You can go to my website. It's simply clinicalpiercing.com. That's clinicalpiercing.com. Or you can give a call to 973-380-4255. If you opt for my website, there is a tab that says contact where you can fill out the information form. You cannot book an appointment through my website. And the reason for that goes back to safety. I must speak to every individual and screen them to make sure that they're candidates for piercing before I make the appointment. they can't swim for 2 weeks after. I need to make sure that that's not happening. And I always ask health questions before I actually make appointments to just make sure that this is a safe thing for them to do. But those are the ways to reach out to me. And I usually get back to people within a day or two. It's just me.
Wonderful. It's been a pleasure having
Yes.
you here. Thank you for
Thank you,
Thank
informing
you
us
so
Julie.
much.
about
I'm going to
that.
clap too, because this is, I'm very grateful for the opportunity to come on and talk to you ladies about ear piercing. If people have questions, I'm always open. People can text me. I answer questions and just make sure it's the right thing for you. It's time to get ready for the holidays. So reach out so everybody can
That's
get
it.
bling blinged. I use genuine
Yes.
crystals, a nice variety of earrings at my office. So you don't have to even buy earrings. I provide those for you.
Provide them.
Okay.
Awesome.
And
One
all
stop.
ready to package.
Absolutely. Thank you
Okay,
again,
so
Julie.
Okay.
thank you, Julie. So we're
Thank you,
going to
Dr.
say
Ada.
goodbye to
Welcome.
Julie and Dr. Ada. Thank you
Thank you
again,
as
and
well.
we'll be back soon for the next
Yeah.
episode of Blueprint to Wellness
Wellness and
and Success
success.
with
Okay.
Dr. Ada.
and PA Smith.
But
Bye,
Okay.
guys.
Bye bye.
Oh,
we
yes.
gotta say,
Yes, we got something to
don't
say.
forget,
Let's
mi
go.
casa es
Es su
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 casa.
casa.
casa. So find us here again next time, all
Yes.
right?
Bye bye.
Okay,
Take
guys.
care.
Bye.
Thanks again.
Bye-bye.